Here's the tumor.
The odd thing is that they call me doctor. You want me to pull the wire out now?
No, don't touch a thing.
I don't even know what I'm doing.
Johns Hopkins is one of America's greatest hospitals. These are the stories of the men and women who work there.
I think there's a lot of attending gossip about us.
Personally, I'm going through a difficult time. You gotta get your emotions under control.
You were acting like a boob.
Without a transplant, he will die.
You have a heart.
No way.
We have multiple gunshot wounds.
It's a war zone here.
I don't want to die.
Hopkins, priority 1, 19-year-old male, under the OC due to assault. At this time, patient is conscious but very lethargic.
Delta trauma, ETA, 3 minutes. Mail to a packet, please.
What's that about? With being a big black man, a lot of people have different stereotypes about you. There's one part of me that's always the outsider everywhere I go. Maybe a lot of people feel that way.
Hey,
hello.
This is Charles. He's 19 years old. He was kicked, punched, banged in the back, left rib area, stomach.
Charles, can you tell me a little bit what happened to you today?
I was robbed.
You were robbed?
My teeth hurt.
Your teeth hurt, so you were hit in the face? No blood in the posterior oropharynx. Is this tooth hurt? Okay. His front tooth is kind of minimally displaced with pain. Are you having tenderness when I push here? Oh, sorry about that. Does he got good access?
So he has 18 gauge PTA.
Look at this.
That's a positive fast.
He's
hypotensive. Let's get moving.
What's going on?
Okay, here's what's going on. We're a little bit concerned because you're having so much belly pain and you were hit in your belly several times, okay? So we're gonna take good care of you, but right now it seems like one of your exams is suggesting you have a little bit of blood in your belly and that's why you're having some pain.
What's gonna have to happen?
Okay, so what may have to happen is you may have to go to surgery.
We'll put a groin liner in your vein, Charles.
Oh my God.
You gotta try and relax and take some deep breaths,
Call
okay?
the pressure when it's come up again.
Okay.
It's gonna hurt.
It's gonna be sore, but we gave you some medicine. We'll give you more.
Sorry, I'm just numbing you right now.
Yep, we're almost done.
Here comes the pressure. 1, 2, 3, pressure. 1, 2, 3, pressure.
Oh, my motherfucking Lord.
You finished? So painful. When anybody usually puts in a cordis, especially in a trauma, you want to do it relatively quickly. And you want to be definitive, you want to do it. And in this case, with one stick, I was able to get in. So that was good for us. There's always a mix of luck and skill. I think more skill than luck, but you know.
Thoracic. Turn page. Why don't you get in 3 units, put a central line in, and we'll go from there. All right, man, let me know. Bye. You know, the joke was always among the wives that they were widowed, you know, because they were married to a physician.
All right, boss. Okay, this is the consent form for the operation, okay?
I've changed my mind.
Okay. All right, well, have a good day.
Thank you.
What we're gonna do is a coronary artery bypass.
Okay, so the reason why we're doing the operation is because you have coronary artery disease. So an incision on your breastbone here.
Now, there's only one way I'm going to go forward with this. I have to get out to see the Giants in the Super Bowl.
We'll make I'm canceling. Okay, we'll make arrangements to make sure that happens.
I can tell you don't really care about the Giants.
I'm a Cowboys fan.
Oh, good. Great.
Nice to meet you.
Pleasure.
Yep. Transfer back, please.
Thank you. One moment while I transfer your call.
Thanks.
Hey, tell me what's up.
You know, the biggest deal is, you know, Amber and I, we had a little talk last night, and she just goes, look, you know, the feeling I get from you is that, you know, you're really only here because of the kids, and I don't deserve that, and...
Oh, no kidding.
Yeah.
It hit a point of no return now, huh?
Seems like it.
Are you going to start proceedings?
That I don't know, probably. But bottom line is, you know, I'm not treating her the way she deserves to be treated, and I have a whole lot of personal issues with that.
She's right.
Yeah. You just, you always wonder if you're making a mistake, but...
You don't want to make a habit of that, second-guessing yourself.
Right. All right, man.
Take yourself down. There is no one here who will help you now. Some great cloud is cleared, but they left you out.
That looks like it's one of the transplant coordinators calling. Hey, Kate, how are you? I'll do the consent and look over the orders of the intern. Are you going to call the HAL line and call the ORT man? Okay, bye. All right, so lung transplant tonight. We're going to be in the operating room at 12:30. I need to find the charge nurse.
Yeah,
Big day.
very big day.
It's about a 15-month effort to find what was wrong with my wife as far as not being able to breathe, just a shortness of breath.
I have a disease called bronchiolitis obliterans that has destroyed the smaller airways in my lungs.
Generally, you know, we say that somebody who has a life expectancy that's poor, meaning not going to be around in a year or two, is someone that we consider for lung transplant.
We were #1 on the list for 26 days. Today's the 26th day, and it's my birthday, so I'm having a very good day today. We're hoping for the best. Best birthday present I could give.
He's just tired of driving me around like Miss Daisy.
Yeah, but I kind of like that handicap sticker. That's nice.
Everything is about time. You generally have 6 hours from the time you start to take them out in the donor to get them implanted in the recipient. It can be nerve-wracking.
We are on the way to the airport for another adventure in transplant.
Well, the stakes are is that you don't know when the next chance this patient's going to get. That's what the stakes are. So things have to go just right.
I've had dreams that I just go downstairs and fling open the front door and haul ass down the street.
Hauling ass, that was a good memory.
Yeah, just that's what I do.
We've never seen you run.
No, I never have.
You're gonna now, huh?
But I'm going to.
Soon.
There's this family back there of about 20 people. They're all very excited. You don't want to ruin that by messing something up.
Just to go over with everybody. You know, it's a big operation. The risk of the operation, as with any, are infection, bleeding, risk of anesthetics. Two big ones with this operation. It's a risk of dying from this operation, something awful happening in the operating room or shortly after, and a risk of the lungs not working.
It's tough, very scary.
I need time with Larry. Hi. You know, we've only had 5 years together. We had lots of stuff we want to do, so whatever it takes.
Good morning. Please say or spell your first and last name.
Megan Quick. Hi, this is Megan. Can I help you? We are flying to get a 3-month-old, and they think that he might have an arrhythmia and go into cardiac arrest. So that's kind of the urgency. It's like Superman. You go in the closet, you strip down, you put the flight suit on, and then you're out. You got everything? Okay, I got it. He's cute. He's like chilling, he was all calm. So he is a little 3-month-old who came into his doctor's for a regular appointment. Turns out that he has an arrhythmia of his heart. Looks very good, but they tried to give him some medicine to change that, and they were unable to. Right? Yeah, you think it's funny, but it's not. Give your mom and dad a heart attack.
So the kid has an abnormal heart rate that's fast. Babies, they do better with that, but still it requires a lot of energy, and the heart will get tired.
They told me what's going on with his heart. It's just not firing properly, and we're going to try to get it back to where it needs to be.
Obviously, we don't want him to stay in this rhythm. Our next step would actually to do a cardioversion, and that's when we actually shock his heart.
Sorry, do you want to step out for this and then come back? I'll be okay for this part. If you have
No,
to,
it's going to happen
it's all
quickly.
going to happen right away.
Yeah. I would recommend you to stay out just, only for, it's traumatic.
with me.
Stabilize this IV.
We're gonna give him some medication to make him sleepy.
His heart rate is now about 220.
214.
218.
We're going to give electricity to get rid of the bad flutter.
I didn't know anything was wrong. I couldn't tell. I just saw that his heart rate was really high and sent him over to the hospital.
Everybody clear?
Clear.
Charge. Charge. Ready? Shot.
That's it. She's out of it.
Did we shock you back in?
In most cases, we just don't know what caused it. But in most cases, once we get rid of it, it never comes back and we're good.
You're doing good, buddy. It was scary. It was really scary. But I'm just glad he's doing okay.
This is every PICU nurse's dream, like a kid that's cute, healthy, that you can hold, because normally we don't get to do that. So I make everybody happy when it happens.
What's up, fellas? How you doing? All right. Hey, Will, have you talked to him yet? Can you let him know that we're here and that if there's a heart team, they can go ahead and open, and that we need an adult bronch?
Hi. Just wanted to come talk to you and ask you a few questions.
Okay.
So I understand you're getting a lung transplant this morning?
2.
2. Hopefully at the same time.
When the lungs come back and they're perfect for my wife and the surgeons do a perfect job, then I will be perfectly happy.
We just came to the hospital where the procurement is, and we're just kind of getting organized. Everybody, there's going to be multiple teams here, so everybody's kind of getting their stuff organized, and then we're going to go in the operating room and get started. Hopefully the patient's in there, and we'll just kind of prep and drape. Help me.
How we get the water here?
How do we turn on the scrub setting?
Is it automatic?
I don't know. I tried that. I mean, I've been doing this whole thing, and
Just kick the plate.
I tried that. Harder.
Oh, yeah. Make us look for that one also.
Hi.
Hi.
Brian.
And what part are you for?
Lungs.
Lungs.
Yeah, thanks.
The two ways that we look at a set of lungs. One is kind of what it looks like. Make sure there's not pneumonias in it. Make sure that it looks good, that it feels good, that it's soft.
Torrance can actually visually look and feel the lungs for me. And then I'll call Ash and tell him what we have. And lastly, they'll have anesthesia send off a gas. It's all about the oxygen, really.
The second way to determine if the lungs are good or not is what the oxygen is of the blood that passes through it.
So they call you back at the gas yet?
No.
Not yet?
Royal male number 2-5. Motor vehicle crossing the street. Currently on response, don't contact vehicle.
Alpha trauma, 3-minute ETA. Alpha trauma, 3-minute ETA.
There's a 12-year-old boy who was struck by a car who's going to be coming in. We don't know much how he's doing right now, but we'll see when he gets here. I have to pee so badly that my hands are shaking, and I had to pee before this, but you know you spend 5 seconds, you go to potty, and you run into trouble.
So we have to do bilateral chest tube.
I'm doing the right side of chest tube. Tyler's going to do the left side. I have to do this chest tube. I'm just letting you know, like, I'll fight for anybody for this chest tube. Just because I don't get that many chest tubes. So if I have to kill you for one, I'll kill you for one.
Right pupil fixed and dilated. Left pupil fixed and dilated. The most important thing is to get him situated here so that we can get him upstairs to the OR.
So we need 2-sided chest tubes as well.
You want me to do that side?
Yeah, I want this one so badly. And he's willing to trade. I know, I don't want to steal our procedures. I wanted that chest tube for multiple reasons. Everybody wants a procedure because you learn that way. It's a pediatric chest tube. Those are rare to get, the training and the experience for that. I've done a few chest tubes. I hadn't done enough to feel like uber comfortable with it.
We're pushing a unit of blood right now. What do you need?
I was going to try the 28, but because it's big, but
Yeah, we've given 2%. We're 30 to 35 on your.
I have it right at the last About 6 right now.
I'd like to get him upstairs in the next 10 minutes.
If you just want to give me a hand, then you can probably do it a lot quicker than I don't want to hold this up.
We need another 2-0.
Can we get a 2-0?
Okay, let's pack him up and get ready to roll. We have oxygen, we have suction, we have our chest tube, we're ready.
I tell you how many times I never get chest tubes. Like, I just needed that so badly. It's sad. Oh.
The anesthesiologist here, the lungs are a go, so
this isn't gonna
she'll be out of the room in the next couple of minutes.
Big moment.
It doesn't seem real, you know?
Go up to pressure 30 and hold again, please. Gas sucked ass. 188.
The organ's gas exchange and basically the organ's performance should be the best, should be perfect.
Is there any way I can get a little better suction than this, maybe?
No rush right now. Hug and kiss, and you can all the rest of the family come up, and
You're scared for me, too?
Of course.
take very good care of her.
I'm perpetually pregnant. I've been blessed with good fertility. If I could take off 6 years from my job and be a stay-at-home mom, I would. Unfortunately, my kind of job doesn't really allow for that. Hi, Mr. Hutchinson. I'm Dr. Boyle. It's a pleasure meeting you. Okay, I'm just gonna have a seat. We can go through things. Did you find me on vasectomy.com?
Yeah.
Okay, all right. So you're 25 and you're interested in a vasectomy.
Yeah.
Okay. The only thing that I want you to be aware of is that we look at it as a permanent form of sterilization. Even though my favorite thing to do surgically is to reverse these, it's not 100% successful.
Okay.
Okay? I don't do vasectomies with the intention of reversing them.
Yeah.
You know?
Yeah, I got that.
Okay, so I just want to make sure you're sure of this, you know,
Yeah, I
before we
thought
do
about
it.
it for
You've
a
thought
while.
about it? Okay.
Yeah.
All right. Basically, what it is interrupting the communication of sperm out into the ejaculate. Are you involved in a relationship right now?
No.
No? Okay. All right. And so you think regardless of a relationship that you might be in, that even if she desires children, you'd not
yeah.
want? Okay.
Just most people I know have kids already.
Okay. So let me have you stand up, okay, and pull down your pants, and I'll take a peek. All right, so regarding the piercing, what I'm gonna want to, no, it's fine. What I'm gonna want you to do though is remove this. I've seen a penis with a rod through and through that goes through the urethra. It's not uncommon. It's not uncommon at all.
This is a picture of my ex-wife. I met her and like 3 months later we got married. One of those Russian deals. She's already had a kid with somebody else. So kind of shot me down.
Brenda's family. My name is Susan Riddleberger. I'm the nurse that's going to be in the operating room with Brenda, and I'm going to keep you updated as to how things are going in surgery, when the organs arrive, and just as much as I can tell you.
Let's get this over with, okay?
We're waiting to find out if the lungs are good enough for this patient, and we're waiting for the blood gas results from the donor hospital.
Hey, what's our current vent settings, boss?
It went down.
And you went back down to 40% now after you sent the gas off? And it doesn't make any sense. The gas that we got back is unacceptable, so.
The lungs look good and they feel good, but the levels of oxygen that are leaving those lungs are not good enough.
I have 145 here, but then this one's 356. Left inferior is 145.
Okay.
So the right looks better than the left.
Yeah, but it's still not good enough. For whatever reason, we've lost our oxygenation. You just get depressed on so many levels. I'm calling Alish.
Hello.
Hey, how's it going?
Good. Did you send the venous sampling?
We did, but it was on the old ventilator settings, and they sucked. Like the left superior was 345, and the left inferior was 145, and the right superior was 350, and the right inferior was 270.
You should have better gas exchange than this.
Do you want to redo the sampling at all before we call it?
No, we're gonna call it. Why don't you come back?
Okay.
Okay.
All right, thanks.
Thanks, man. Appreciate it.
Yeah, no
All right,
problem.
bye.
All right. We're not taking them. Not good enough.
The lungs are no good.
Oh my.
I'll come up and talk to the family. But,
Okay.
bye.
Dr. Shaw's going to come up.
There's gonna be massive disappointment back home, I'm sure, with the family, the very involved family.
Y'all set?
Yeah.
Okay.
As far as I know.
As far as you know. Good. Good. You took out that piercing, right?
Yes, I did. I did that myself, and I didn't use anything.
You did that one yourself?
Yeah.
I'm just going to take the penis up and out of the way because we're not dealing with him right now.
I'm gonna close my eyes in like 5 minutes and just hope I don't feel too much.
All right, you're gonna start feeling me just down here. You might feel like somebody's kicking you. You don't have tongue pierced, do you?
I did. I had my tongue done and stretched out. I had 2 hoops in my lip.
Oh my gosh.
I've had my nipples pierced before. Boredom, I guess. I took them all out about a year ago so I could look a little more professional for my job.
Anything sharp?
Nah,
No.
I don't feel anything.
So from where I cut on out, there are sperm that are living and ready to go and can cause a pregnancy. I make my patients wait about 2 months before having unprotected intercourse. Your job tonight is to go home, straight from here, lay on the couch and do nothing, okay?
I've been setting myself up for that.
The reason you'd have to call me tonight, tomorrow, would be your scrotum started to swell up. I don't know what makes a person this young with no children sure of a vasectomy. I think this is the kind of patient that may change his mind in 5 years, depending upon the partner he's with.
All right, take care.
But he's an adult.
Take it easy.
It's his body, and it's his decision.
All right, y'all have a nice weekend.
Okay.
Hey, guys. Hey, Brenda. Hey, how you doing? You okay? Listen, those lungs aren't good enough for you. I'm sorry we got you all the way this far. The gases weren't very good, meaning the oxygen levels weren't good enough for you. Okay? You all right? Okay.
Do you ever listen to Rancid? No. Oh, they got a song called Born Frustrated. It's really good.
Hey, guys. The lungs aren't good enough. Normally what I like to see is a oxygen level of over 400, and it really hasn't got that far. So I'm not going to take a chance. I think there are better lungs out there for her, I think.
Good.
So
She needs the best.
right, and you know it's a calculated risk. You know, bad things can happen between now and when we finally do find her, you know, a set of lungs. But I just don't think these are good enough for her.
Go back home and wait.
I think go back home and wait.
Okay.
Okay.
Thank you, Doc.
Okay, guys. I'll see you later. Yeah, the downside is that something bad could certainly happen to her. She could deteriorate between now and even this weekend and not even become a candidate anymore for transplant.
Said only the best for you.
We'll be doing this again.
Yes, we will. This is just a dry run. I'm glad you're okay, whether you got lungs or not.
To hear more of the music from Hopkins, go to hopkins.abcnews.com. Hopkins continues.
Do you remember them saying it's a no-go?
Yeah. He came in and said, we're going to have to call this an aborted surgery. The lungs are not what I want for you.
So you were actually on the operating table?
Yeah. Strapped down.
Wow.
And I was like, okay. This is a concentrator. It concentrates the oxygen. The oxygen comes through this tubing. And I have like 50 foot of cord, so I can pretty much go anywhere in the house. I have a spreadsheet of the pills that I take, and I have to check them off every day, and the timing and everything. And I know that after transplant, there'll be even more pills. So I'm gonna have to get a bigger spreadsheet. Gosh, please don't trip on this.
The secret is never take your eye off the ball.
I wonder why I couldn't breathe. I was standing on my airline.
No, that was me standing on it. The only way I can win is standing on your airline.
All of a sudden, your lungs are damaged to the point they're not going to keep you alive. It's kind of bizarre. That's it for me. Nobody knows how much time you have. I mean, I want to be able to hold my grandchildren someday. I want to have some grandchildren.
That was good.
Yeah. I would like some more beach time and just some more picnic times, some more get-together times.
And breathe.
See how much better you do after a $200,000 or $300,000 transplant.
Good thing you have insurance.
Very, very good thing.
So today's Sunday. Going home to hang out with the kids. They want to go bowling, so we're gonna go do some bowling.
Hey, Dad.
Thanks.
Hello.
Hi. The hard thing is that I think we're split. Amber and I have agreed that it's probably best if I get my own place, and so I'm gonna move some of my stuff into the place so it can be at least functional. I'm getting it. You're sharing with Riley and Jordan. In just a little bit. I feel apprehensive just about the whole day in general. You know, it's just I think it's a risky move, and I'm not sure if it's going to be the right move. Oh, that was this bottle of wine that I was going to drink tonight. Okay. You did? I just dropped that bottle of wine everywhere.
What are you doing?
Oh, I dropped a bottle of wine on the front porch. Did all that make sense, what I told you? Huh? This is just what, you know, this is a modern day situation. You know what I mean? It has nothing to do with you guys. You guys are the best kids in the entire world, hands down, clearly. You guys are Thunderdunk kids. You know what I mean? Great athletes, you're smart, you're beautiful, you're nice, you're good-hearted. You've got all your priorities in the right spot.
It's really hard right now because my parents aren't really getting along well. Just knowing there is a 50-50 chance of them getting divorced and a 50-50 chance of them not. I'm just worried, like, if they do get a divorce, what's gonna happen? Who's gonna get custody over us and stuff like that?
I put your picture away, sat down and cried today. Since you've been gone, my world's been dark and gray. Since you've been gone, my world's been dark and gray.
Come on, roll!
That's a good try, though, hey.
It's not fair to the kids to have to witness all this. It's hard on them. It's still going? It'll make it.
I didn't even get my first cup of coffee, and the phone rang, and I saw it said Johns Hopkins on the caller ID.
We drove 80 miles an hour to get up here and broke a few rules.
You from Baltimore?
No, we live in Stafford, Virginia.
Oh, how far away is that?
96 miles.
She has been deteriorating quite a bit, and our goal tonight is to get rid of her old lungs and give her 2 new lungs.
We're going to Puerto Rico to look at a set of lungs for one of our patients up here.
Hello again.
Hello.
We meet again.
How you doing?
Okay.
Same deal. We won't know until we actually see the organs and have to make a decision at the location. We're taking them from quite a distance because of their quality and because it's a good match, and that's the only kind of X factor. That amount of time can lead to trouble.
Unlike some of the other organs, the lungs are extremely fragile, and we're not as good with preserving them, and so we're in a hurry.
If after the team looks at them and they decide that they're good, then things will move pretty quick.
No. But,
Okay.
I'll check my email right now.
Okay.
Dad, don't tell me you're opening a beer.
I am. I'm off tonight, buddy.
You are?
I am.
Have you found an apartment, by the way?
Yeah, I have.
You have?
Yeah.
Does it have a TV?
No.
Darn it. Wait.
I'll keep you busy.
Hey, guys!
We ate Five Guys kind of late,
Okay.
so they haven't eaten dinner yet.
Okay. How was bowling?
I scored.
Good job.
You know, kids are very in tune to tension and when things aren't right. That's just not a relationship that they need to see.
I do.
These faces, they'll be saying goodbye, goodbye. Don't make me say it, don't make me say it.
I'm eager and ready for my marriage.
Really?
August 25th. We're thinking about going down to Miami. Thinking, we'll see.
Wow. That's the biggest mistake of your life, man.
The bachelor party or the wedding?
Both. No, the wedding's great. The wedding's great. Bachelor party, though.
Bad idea? I had one anesthesiologist tell me, don't get married till you get out of residency. Wait till you're finished, and you may be surprised that the woman who's good for you when you're stressed out is not necessarily good for you when you have more balance in your life. Yeah, I think that's it right there. I think even if the wall is that big, it looks cool. My fiance is a wonderful person. I'm very lucky to have her, I think.
Let's try this temporarily. I think it's straight. What do you think?
I think it's cool. It works. Doesn't it?
But what?
Like the wall is huge and everything. It's a little bit, but it works. But I think it's the right decision. I think we're ready. It is too low. It's exactly what I thought from a distance. You don't think so?
I think it's fine.
Success. All right, all done. Congrats.
Okay, well, we got some pictures out.
You are Brenda Thompson?
I am. We're just getting your paperwork together, and then we'll be taking you back now. Okay. Okay. All right.
Here we go again.
This is her third marriage, and I was a product of the first. I've been with her through all three, and it's amazing how happy she is. We're all ecstatic to know that he's doing anything and everything for her.
This is where we're gonna give our hugs and kisses.
He has a lot of her strength right now.
You and me in a bright blue sky, in our own little world, and I feel so high, and I don't need much more.
Okay, step up.
ORC, this is Amanda. Cross clamp was 7:02.
Beautiful.
Their estimated time of arrival is between 12 and 12:30. He'll call you as soon as he lands at PWI.
Okay, great. They made the final evaluation of how the lungs look, and they were happy with it, so they're recovering the organ right now.
I think it might happen this time.
The lungs were awesome, and they were handled exquisitely, Dr. Shaw.
Let's go ahead and scrub, then I'll mark, and then you can prep.
I'm gonna raise the back of your bed so it's a little bit easier for you.
We're about to take a short trip by helicopter back to the hospital.
Left lung inflated, right lung deflated. All right, guys, we're going to take this right lung out.
We heard the helicopter. That was it.
It's been about 5 hours since we first started harvesting the organs.
We harvested a great set of lungs. Although it's been a long time, everybody's excited.
That was the helicopter. Big old white box. Just like you deliver every day, Sean.
Here's Amanda. Hopefully you guys are ready for us.
Okay, rotate the table over towards Dr. DeSimone, please, and drop this left lung.
They're putting the lungs in now.
She's doing fine.
She's very stable. Everything's going as planned. It will still be a couple more hours.
Wow.
We've begun to sew the new organ in. The premise is that this lung's got to work.
Testing the airway.
Okay, go ahead. Room air on the right lung only. There's certainly a moment when you take the clamp off. Man, I hope this thing works.
The breath. Here it comes.
That's good. Suck it out. Suck it out. It's a good start. Very nice. We've now basically disconnected the left lung, and she's now being supported completely by the new lung on the right side. We don't like to keep this up for too long. She won't like it, so we got to get this other lung in quickly.
We're just waiting for word for the final lung being implanted and close her up, and then we get to see her.
So we're all done. 3 connections. We'll inflate this left lung, room air, nitric oxide. Keep coming. Beautiful.
Hi, Thompson family. Both lungs are in, and they're pink. They're working.
Oh yeah, there's definitely a nice flow in the left superior.
Tell them to keep up the good work.
Keep up the good work. Hey, Ash.
Yeah.
The family says thank you, thank you, thank you, and keep up the good work.
Great. Okay. Thank you.
Both lungs, both of them are working, left and right.
All right, guys. We'll see you in the unit. Thank you.
I can't wait to see her. Just a few more minutes. We're standing at the door ready to have her wheeled out and on to ICU. Everything went perfectly.
Everything went great. About an hour.
Holding on to her.
The communication to the family is so far so good, but we got to be prepared for trouble in the next 24 hours.
Still an uphill battle.
Made it.
Hour by hour, apparently.
Yeah.
To see last week's episode of Hopkins, go to hopkins.abcnews.com.
I probably won't see Amber until Sunday. She has her sister in town, and things are probably just better off if we let things cool off a little bit. I've got some friends who live local, and then also some resident friends, and we're just going to go out and have some dinner. And really, I'm just kind of do it to, you just try to keep yourself busy and keep your mind off everything that you're going through. Guys, I'm going big tonight. I'm letting it all hang out.
Let's get him with his teacup.
Cheers. Cheers, cheers.
How's your apple juice? Awesome juice. We got a sippy cup?
Being a father and a husband, having 3 girls, and then realizing that marriage maybe not working out the way that he thought, and maybe proceedings are taking place towards a divorce. I wouldn't wish that on my worst enemy.
So, dude, talk to me about single life.
What do you want to talk about?
Where are the hot nurses? Tell me. Seriously, what for us?
Tonight's about maybe escaping a little bit, and I think that's good. I think, it's a temporary fix, but I think tonight we're going to do our part to make sure we fix them now.
Bartender.
Ready to roll. See my shirt? I'm done. I'm ready.
Bye-bye.
Broadly speaking, at 5 years, a little over half the patients who got transplanted are alive. If you take everybody.
2 weeks now, actually about 15 months we've been waiting for this minute. We're all very excited.
I guess this looks like the Boondocks compared to Baltimore to the city, huh?
We've got patients who've lived 10 years, 12 years. What their secret is, we don't know, and we need to study them carefully.
You've got this foreign thing in your body that's always foreign to your body. So there's always a chance of rejection or infection. You just have to take it one day at a time.
Just you and me. You and me in a bright blue sky. No clouds in our way, no tears in our eyes. Just you and me in a bright blue sky. In our own little world, and I feel so high. I feel so high.
Coming up on Hopkins.
You were acting like a boob.
She's kind of said her part, and I've kind of said my part.
There's a lot of gossip about us.
It's gonna be a long night.
Best of Baltimore, baby. Best of Baltimore.
The alternative is no operation.
And death.
Right.
As soon as they land, I want to start taking his heart out.
If we miss this 9:30 plane, there's not another one.
We don't have an airplane.
To purchase Hopkins on DVD, log on to abcnewsstore.com.